Hello and welcome to today's session on how businesses can support employee mental well-being. My name is Nadal and I'm a public health lead at Wandsworth Council. This session is part of a series of workshops, webinars and resources that Public Health Wandsworth have been developing to support local businesses and employers on their journey of becoming a healthy workplace. Our previous workshop delved into why employee well-being makes commercial sense for business, and today we're looking specifically at employee mental well-being. The webinar today is being delivered by Let's Improve Workplace Wellbeing, a non-profit community interest company whose aim is to support workplace wellbeing. Before we dive into the webinar, I'd like to draw your attention to the Council's Healthy Workplace webpage, which has links to the previous workshop I mentioned and information about other resources. Some of these resources include a Healthy Workplace Award, which is administered by the Council. This provides businesses and employers within the borough with a framework of evidence-based criteria, which can act as a template for good practice and recognises employers in the borough who invest in their employees' health and well-being. Using a framework such as this has many benefits, such as allowing you to benchmark your organisation against an independent set of standards, provide you with an evidence-based blueprint to design your employee health and wellbeing programs, and gives you the opportunity to gain recognition as a top employer. The framework is made up of 3 pillars, which you can see on the circle diagram on the slide. The first one being corporate support for wellbeing, and then you've got mental health and wellbeing, and healthy lifestyle promotion. Today's session will provide you with an introduction on how businesses can support employee mental health and well-being. This pillar, the mental health and well-being pillar of the framework, covers organisational policies and culture management, knowledge and behaviours, and employee knowledge and resilience. If you'd like some more information on this, please contact us at publichealth@wandsworth.gov.uk. I'd also like to highlight the Supply Wandsworth programme, which is being delivered by the Council's Economic Development team and may be useful for local businesses in Wandsworth to have a look at. You can find this again on the Council's website, and just if you put in the search bar Supply Wandsworth, it will come up. Environmental, social and governance investing has increasingly meant that for businesses to be supplier ready, they must demonstrate their commitment to influencing positive health outcomes with the work they do. Becoming accredited with the local Healthy Workplace Award can help evidence your organisation's commitment within bid applications and investment opportunities. Another resource that businesses and organisations can use is the Making Every Contact Count training, MEC. This is an approach to behaviour change that uses the thousands of day-to-day interactions that organisations and individuals have with other people to support them in making positive changes to their physical and mental health and well-being. There are a number of courses that can have a direct benefit to staff themselves and consequently will have an impact on their friends, colleagues and families. It can also improve job satisfaction of your workforce by equipping them to be better able to help others. A course that's relevant to today's session is the Emotional Health and Wellbeing module. I've put a little screenshot. It's the training's available online and takes between sort of 30 to 35 minutes to complete. This training is available free for local businesses and organisations to access, and you can find information on the Healthy Workplaces webpage and the Council's website on how to access. But if you've got any issues, do contact us. Lastly, I'd like, if you have any other areas that would be helpful to help empower you as an organisation to thrive in becoming a healthy workplace, please do get in touch at the email address shown below. I'd like now to pass on to Nuz, who will go through the webinar today. Thank you very much.
Good afternoon and a warm welcome to the second installment of Wellbeing Awareness Workshops. A big thank you to Nadal Al-Awazi as the Healthy Workplaces lead for leading this agenda to really bring together us in these learning sessions. If we recap on our previous session, we discussed in more depth defining well-being and that commerciality. Why is well-being so important in today's agenda for any size business, be it large or small, across any sector? So in this, our next series, which is part of a 3 series, we dive into how businesses can support employee mental health. It's also to reiterate that we would love to hear from you. And if you would like to reach out to take on further conversations, this option is also open. We will be leaving some details of email addresses that you can actually contact Nadal on and be able to take these conversations a little bit further. We also know that these are really sensitive topics. So at the offset, we want to reiterate, if you or anyone is feeling down or is needing that support or is struggling in any way, please use a channel of support. There is the ability to reach out to the likes of Samaritans, Calm, Step Change, and a really big one that I think is quite good in a world sometimes that we don't want to interact directly is Shout. All you need to do is text the word Shout, SHOUT, to 85258. That's SHOUT to the number 85258. So moving on and introducing myself, my name is Nurshagan. I work both as one of the leadership team members for the organization called Let's Improve Workplace Wellbeing. It's a non-for-profit CIC, which means it's a community interest company that really brings together some of the great minds and those wanting to learn around workplace wellbeing to really learn and share from best practice. My background goes through a journey of being head of health and wellbeing at IKEA, UK and Ireland, and then coming out of that role and really focusing on workplace wellbeing strategy, but also thinking of a holistic approach to wellbeing. I have been a big advocate for mental health. I'm also a mental health first aider, and I've added an extensive plethora of experience to delivering mental health programs. But at the core of it, it's not just about delivering those programs. It's also that I have lived experience around poor mental health and how do you build your resilience and also face those challenges that many of us will actually face during our time. So really that's a little bit about me. And then moving on, we go on to what we really want to discuss today. So I've done the welcome introduction to Let's Improve Workplace Wellbeing. We'll be really looking at defining mental health, psychosocial risk, and psychological safety. And that's important because we want to be able to understand and define some of these words, etc., that we're thinking about. The current landscape and legislature. So there's a bit about defining and giving you the basis of the stats. How do we reduce stigma around mental ill health? Because the first step really is around creating that safe space to enable people and support your employees to start opening up. How you can encourage and build supportive communities and promote open conversations. Aligning and thinking about tangible actions you can take to support mental health with your employees. And a few bits around the questions and the resources that we have. Please reach out if there are any questions. We'd love to hear from you. So really moving on and defining mental health. So what do we mean by good mental health? It generally means that it's the ability to think, feel, and react in the ways that you need and want to live your life. But if you go through a period of poor mental health, you might find ways you frequently thinking, feeling, or reacting becoming very difficult. So, and often it can be a very difficult time. And how do you cope? This can feel just as bad as physical illness or sometimes even worse. Anxiety is the feeling of unease, worry, or fear. So everyone will feel anxious in their life. However, some find it hard to control their worries. Depression, on the other hand, causes long-lasting impacts. It goes beyond just a low mood. It can impact people physically in terms of they have difficulty sleeping, they can't get out of bed, they may be sleeping too much. They may really be exhibiting things of perhaps being short-tempered or perhaps feeling teary-eyed a lot of the time. They may try and extract themselves from social settings. So it's really important to see the difference between what good mental health can be, what anxiety is, what low mood is, and what is depression. And then it's really to define psychological safety and psychosocial safety. Now, you wonder why I'm bringing in these definitions into this discussion of how we support mental health of our employees. No matter what size your organization is, it all starts with creating that psychological safe place. And that's why psychological safety is to understand that it's to give your employees the space to feel comfortable about speaking up without the fear of negative consequences within their team or their workplaces or their jobs. So really it starts with, if anything, when you are supporting mental health of your employees, is how do you really create the psychological safety? I put in your psychosocial safety because that is extending and going a step further. And that's really crucial when you are an organization thinking about the well-being framework or thinking about mental health in your organization. Psychosocial safety, or often related to as psychological health and safety, goes that step further. It's not just about feeling safe to speak up without any repercussions. It's about how you as an organization create an environment where mental, social, and emotional well-being are actively promoted and protected. And that can be using a risk management approach. So we're not going to go into a lot of detail around the risk management approach, but I'm going to leave you with something to be thinking about when we talk about how do we support mental health in the organization and that of your employees. It's important to really take a pause and look at the current landscape and legislature out there. So this is the latest report from the Health and Safety Executive. It looks at health and safety at work in Great Britain for 2023. So it's the latest set of data that you will have, that it's relatable in terms of where we are at the moment. And I'm sure many of you as business people will be very driven by KPIs around data. So it's really to look at that. I think looking at this figure at the moment, you've got 875,000 workers suffering from work-related stress, depression, or anxiety. That's new or long-standing. 338,000 workers suffer from new case of work-related stress. We're looking at 17.1 million working days lost due to work-related stress, depression, or anxiety in 2020, 2023. So it's really important to understand when we are taking this conversation that this goes beyond, not just only taking care of the mental health of your employees, that there's an impact to our economy, there's an impact to lost days of work in productivity. And this is why we come back to why it's really important to look at it and to understand. We looked at, even digging a little bit deeper, we know that large workplaces had significantly higher rates of work-related stress. We know that females, that's 3,200 per 100,000 workers, had a higher rate of work-related stress, depression, and anxiety than their male counterparts. We know that stress, depression, and anxiety account for 49% of all work-related ill health, and 54% of all working days are lost due to work-related illness. This really is something to be thinking about when we think about, our commerciality and what does that mean for our business. So some of the examples of what respondents actually said that related to the lost days related to stress, depression, and anxiety. Some of the examples were, I'm going to give you two. Workload pressure came out quite high. So this is too much responsibility or too tight deadlines. It also was around the lack of managerial support. So it comes back to how do you support your employees in terms of their mental health in the workplace? And it comes back into ensuring that there's a psychologically safe space to be able to speak about it, but also at the same time, what support mechanism is in place for managers as well as employees. So moving on, we talk about that intersectionality between poor mental health and then the impact on physical, financial, and social well-being. It is fast becoming an epidemic. We can see that there's knock-on effects to things like health, but also if we just take a moment here just to see from some of the impact that there has been out there, that the data that has been coming through the Warwick and Edinburgh mental well-being scale, 83% of those that were interviewed feel tired, 66% are struggling to sleep, 73% can't feel relaxed, 58% feel disinterested, 52% can't concentrate, 62% cannot control worrying. Now, if you take these figures and perhaps you're looking at it that it's in a survey that's unrelated to perhaps your workforce, it just gives you a snapshot of thinking of where people are in their journey. And if you're looking at these figures, they're very high figures. So we need to be careful in terms of how we think and what is going on in the world at the moment. So on that note, it's really to leave you a bit on understanding the situation where it is at the moment. So first, in the first instance, of course, is how do we reduce the stigma around mental ill health? It has to start there before we go to the action in terms of what we can actually be doing physically to support our workforces. And there are different approaches to mental health and illnesses. I think you need here to think around, if you are a mental health first aid or considering some training around mental health awareness, it's that as an individual, as an organization, there are clinical diagnoses and treatments that vary. And depending on backgrounds and how different groups cope with it, it's really to take a moment to think in terms of that. If it is anything clinical, it is always in the first instance to direct an individual to the NHS, be it through 111, or if it is really in a dire need, to actually call 999. I think it's really important that we do that. And it's also to understand that those clinical diagnoses are not something we as individuals can undertake if we are not a professional. What can we influence is that we can actually influence how an individual goes from low mood to depression by creating that atmosphere of trust and the ability to really listen. So this is where it is around listening. It's around encouraging self-awareness. How do you as a manager or as someone in your organization get together in terms of coaching, and how do you allow the individual to share that vulnerability? We know the cost of living crisis is hitting households a lot. So we know how can we be thinking of supporting our people that are going through a lot of stress and worry around this topic. So for example, when we talk around, could you be offering some financial counseling or signposting to the right resources? Can you create an atmosphere of social inclusion in the office? As humans, we crave connection. So it's really key to create pockets of this to ensure it's not only about the work, but also that people feel a sense of belonging. We know that work-related stress needs to be addressed. So how do you create that atmosphere of trust? So again, it comes back to that listening. How are you listening and creating that atmosphere where people can contribute to the conversations around workload? What support do they need? It's looking at the moment, an example is, the flexible working for people who have parents and children. We saw this come up quite a lot during the pandemic. It seems to have lost a lot around it. Of course, it's job related and sector specific. However, it is around speaking to people so that they feel that they are supported and can be more productive. So, some other examples are opening conversations like, what are you finding helpful for supporting yourself at the moment? So really, you've gone through the stage of listening. How do you create that self-awareness? Asking questions around, is there someone you can speak to? Where do you think are the gaps in support for you at the moment. So this is where that self-awareness, creating the self-awareness within yourself, but also the individual, and really using the questions to use in terms of a coaching way. Are you able to find resources? And if not, can I help you find them? And then other examples are also, how can you implement things like walk-in talks? What are your check-ins like? Are they very work-orientated and very focused on work? Or is that creation of honesty and openness coming in? And as I said, there is the criteria of asking people around how they are doing. And we do need to face this because we are seeing an uprise in very sensitive topics, as in people taking their lives as a result of suicide. So it's really important for us to watch out for the warning signs, the behavior changes, the increase in certain types of behaviors, such as social distancing. How are people pulling away? Are there mood swings? Are they unexplained, aches and pains, or being off work due to not feeling well? So really be thinking about that. I guess how you can encourage and build those communities again and promote open conversations is again reiterating an approach called the glass approach. This is used a lot through different channels, but it's the CLASS. So it's really about connect, listen, assess, and support. So connect is make the time to ask someone that you're concerned about. It's not about giving them advice. It's always in the first instance to connect and listen. So allow the time and space for the person to talk through things. One really crucial example is often we will want to go in with advice. It's to pause ourselves and to just listen. So really connect. And someone can very easily see if you're rushing through something. So be very, in your own aspect, be very precise as to how you make the time to support someone. There is no point making the time to try and listen when you're in between meetings and you've only got a 5-minute slot. So really allocate the time, because this is important. It's important to be present and to listen to what people say. It is really important for you within your organization to really assess the situation and consider the support and the signposting that's there. You are not a clinical professional unless perhaps you are. But for the most of us working in workplace well-being, perhaps you've got a background in psychology, perhaps you have some courses, but you are perhaps not the clinical person that can make that decision. So it's really important to listen and assess, but also be thinking about how you can signpost the person to the right area of support. So this is where that assess the situation, consider what support or signposting may be needed for the person that can help them. That support, make it clear you want to help, and reiterate the conversation is confidential, that you are there to care, and it's about exploring the various avenues they could take. And then it is about that signposting. We have a number of brilliant organizations that are out there at the offset. As I mentioned, there's Samaritans, there's Step Change, there's Calm. There is around, using a tech service such as Shout. We've used a lot of those resources because those are freely available. Of course, it is reaching out to, 111 or the NHS website or calling the local GP. It is really important to make sure those are there. And again, is to reiterate that there's different approaches depending on who the individual is. Terminology can vary. You would have heard of people calling it different things. It's poor emotional health. It could be overloaded, burnout, etc. So be careful again around steering away from certain types of language. Again, I reiterate what I said in the previous in terms of how do you open the conversation when you're connecting, asking questions again, who are you speaking to about your well-being? Who could you speak to about your well-being? What are the gaps in your support? Are you able to find the resources? And if not, how can I help you find them? And if there is an individual within your organization, or there's a group of individuals that are passionate around well-being, how can you really bring them together in order to support this agenda and be able to support your employees with their mental health? And then moving on, I know we all love an infographic. So I thought, if there was one thing that you take away and perhaps have on your desk that you think about all the time as management, as leaders, or within an organization, is I would say it really starts with you. When we talk about mental health, it's how are you checking in with yourself? Because as they say, you can't pour from an empty cup. So being self-aware, how are you as a leader? What are your unconscious biases around mental health? Because unfortunately, when we try to support others with their mental health, we do need to understand what it is within ourselves that sometimes can think, oh, perhaps this person's using this as an excuse, or I don't have the time, etc. So really challenge yourself. It starts with you. Well-being, when we talk about it, is not about only designating it to a few. It's about how collectively we support this agenda. I talk a lot around cultivating empathy, and this is about creating that compassionate leadership. This is about opening the channels of conversation. We can't address the unknown. It's best to know what it is and then collectively be able to take it on board. We don't want to be reactive. We want to be proactive. So it's really, what are the ways that we can support people? How do we open up the conversations? Because we would rather that we are supporting people so they're not going off sick. A lot of the time, and I've seen this a lot in organizations, we've allowed low mood to continue without addressing it early on. And that could have prevented someone really falling into depression. Sometimes some people just want you to listen. They don't expect you to know and have all the answers. It's just really about that, cultivating that empathetic environment. And then talking about a check-in with your employees. What sort of check-in do you have today? It's one of the most underrated actions an organization can take. We often think of these great benefits. We think of all these wonderful things. But at the end of the day, when you talk about Maslow's hierarchy of needs, when we talk about self-actualization, when we talk about human beings and what we need to function, it is a sense of belonging. It's a sense of recognition. It is a sense of someone seeing you. So really, it's about checking in with your employees. Conversations, again, following on from a check-in. Consider how you are actively listening. Challenge yourself actually to taking the time to be present. And I know we are all busy. There are so many things that are going on, but this investment in time in listening to what's going on is really essential. How do you create the support, this peer support within your organization? How do you empower the certain people that are passionate about delivering mental health awareness or are passionate about mental health, and how do they take care of themselves? So how do you empower people to be those sounding boards? Sometimes all it takes is around that peer support and how people can help one another. Wellness plans. What I mean about wellness plans is if you are thinking of your performance appraisals, when you're thinking about your one-to-ones, how do you integrate some of the well-being actions? So a quick one, for example, is on a Monday morning, most organizations have some sort of huddle, a check-in, a stand-up, whatever you want to call it. How do you integrate a well-being action within that meeting? So for example, you get everyone to do breathing for just a minute even. Everybody does a stretch. Everybody tells you one positive thing that they had from the weekend or had in their week. Try and emphasize the positive. And it's not about kind of positive washing anything. It is really about how do you create the small habits to create the bigger actions. I would say really getting to grips with what resources are available. And there's so many out there. These are on hand. And how do you collect these free of charge? Again, this can really help with supporting your employees by getting some of that. And then I would say the feedback loops are really essential. Anything that you are putting in from a mental health support perspective for your employees, how do you get the feedback? What's working? What isn't working? And what can you be doing in order to be improving both as a leader, but also as an organization and supporting your people? And then I wanted to come towards, before I go into questions, really what is the benefit of psychological safety when it comes to supporting the mental health of your employees? Because it really starts there before you go into the big actions for mental health. So we can see from this really nice infographic, it's what are the 5 benefits of psychological safety. There's better levels of communication. You're opening up, you're sharing that knowledge, you're opening up the engagement. When you have more openness, there is the opportunity for more learning from mistakes, and we know that failure, it's first attempt in learning. And that's something that I think is something we do need to take away. We all want improved performance, more creativity, more innovation. So create that safe space. So when people feel safe, they open up more. We want positive employee attitudes, engagement, more commitment to the organization. So this is the reason why it's so important around thinking that psychological safety. We want increased levels of initiative, of identifying ways, of processes, etc., that can really impact positive performance. So this is a really nice summary in terms of the 5 benefits of psychological safety. And then I wanted to come into a bit of the questions that have been sent my way and what are the recommendations, for example. So thinking a bit more about the information, something that was brought to my attention was some organizations are really going through the healthy workplace criteria. They're struggling along the lines of the organization policies and culture for mental health and well-being. So first of all, addressing the organization assesses risks to the mental health of employees, anxiety and depression, and action is being taken to prevent or minimize the risk. So again, it's talking around what actions have you taken to address and look at psychological safety and psychosocial risk. So my recommendations in terms of some of these questions are, first of all, in answer to the first one, is how can you facilitate more social inclusion? For example, if you're doing one-to-ones and making everyone feel that they can have a say, it's also about the organization being open and showing that vulnerability and honesty by managers to share their own experiences. When we hear the permission through a manager sharing their experience, we take it as it's safe for me to also share. My recommendation to help assess risks to mental health are the following. How do you create the mental health support teams? How do you invest in some training up? A couple of people that can understand mental health awareness, understand mental health first aid, for example. I think it tends to get a bad rap, but it's important to understand in yourself how to take a conversation. Again, it's reiterating, it's not about giving advice, it's about signposting, it's about listening, it's about really understanding what this individual needs and how do you allow them to go to the right support. So really investing in things like that. How do we educate ourselves as senior leaders? And this is within your organization. Well-being, mental health agenda is not only for the few to understand and know, it is a collective. So it's really understanding how within your organization, what are the signs of mental health? What potentially is the impact of it? It's about someone's behavior, how they've changed their language. Are they late? Are they looking tired? Do they look run down? What is going on? And really coming back to some of the things that I spoke around. How do you minimize risk? Well, try the class approach. It's really that clear communication around any changes coming in the organization as well can help to remove uncertainty. Signposting, really huge in order to help people to the relevant resources. What do you have internally? I've spoken again, reiterating, you've got Samaritans, you've got Step Change, etc. By implementing a lot of these, that's how you prevent and minimize risk, because there's resources, there's the proper ways of working in terms of that. And also, it's coming back to your core values within your organization. What is your vision and your mission within your organization? What are your values? And then, of course, looking at the policies. So it's, the organization is aware of the risk factors for work-related stress. How do you show the action is taken to prevent or minimize risk? What are your policies like, for example? We know that 80% of employees experience moderate to high levels of stress, and this can lead to anxiety and depression. So what are the levels like in the organization? How are you taking those touch points, those signals in terms of surveys, etc., to find out? And as I said, it is about signposting activity on a continuous basis to allow that support to be more preventative and minimizing risks. It's also checking how your managers are. Do they understand how to lead? This can have a huge impact on work-related stress. We know at least 80% of individuals leave a manager rather than leaving a brand. So it's really understanding how your managers are leading, how are they engaging and working with their teams, how do they understand this and know how to take conversations, because it's not easy. It's really about understanding. We need to be thinking of stress reduction initiatives. So think about your meetings, think about how long they are, understand, that could it have been an email instead of a meeting? Understand that people's brains work differently. So it may not be the most productive to have a meeting at, for example, 3 o'clock or 4 o'clock on a Friday afternoon, because people have had a very long week. Really thinking about a mentally healthy organization culture. What is the culture like? And how are you promoting the discussions and the co-creating between employees? It's really thinking about that. You would have heard me talk about support groups and creating those. They often referred to as employee resource groups. What's your internal communication like? So opening up those channels. How are you creating a sense of inclusion? How are you opening up the conversation around other topics that perhaps you might not have touched before? There's things around grief and things around the menopause, supporting men's mental health, thinking about the tangible practices like mindfulness and stress management practices. It's really encouraging people to have breaks. These are all things that you can be putting into place in order to support some of these questions that have come through. We are shying away from talking about hybrid or flexible working. But again, we need to be thinking about the cost of living crisis. That's causing a huge amount of issues in terms of stress. We're seeing redundancies come through. So the more that you can be, open and more communicative around some of the things that are going on, the more chances that people will be open and start sharing where they are. A good example I always go back to is an individual was having trouble with their performance, coming in late in most days. And then actually when we sat down and actually spoke to the individual, it turns out that the reason why they were late was because of transport costs. Their partner had lost their job. It was getting expensive to get earlier transport into London. They were taking the train after 9:30, hence why they were late. So it's things like that. Is people don't necessarily want to share at the offset that they are having financial difficulties, but we know that is interlinked to poor mental health. So how can we really be thinking about it? When we think also around where business operations allow employees to have the freedom to design their own work schedules, that is, they can choose when to complete allocated tasks. Autonomy is one of the key things that allow people to feel they are trusted and can take responsibility. How do you open the dialogue? We need to be thinking of how we support employees to complete their tasks in the best way, rather than in the time that you as a manager think it needs to be done. And we need to think of a range of initiatives to support and promote flexible working across. So that takes care of some of the questions. Again, thank you very much for your time to be listening in on this. As I said, I would love to open up the conversation much more. So please do reach out to myself as well. On this note, I wanted to share some useful links and resources. So in the offset, I wanted to share some useful links and resources related to Richmond. As you can see, there's publichealth@richmond.gov.uk. Please use this email address if you'd like to get in touch and learn more, to take more conversations like the one today, to feedback as well. We'd love to know what more you are interested in learning about. What are you doing at the current moment? We've had a mixture of feedback in terms of that. Some people are doing the basics. They are asking the question, and that is good. It's starting. There is no judgment as to where you are, but please do reach out. There is a plethora of information in terms of the MECC training that Richmond Council is able to offer. So there are some useful links here that will be attached to this video at the end of the session. So do reach out to see if there's any social care training, anything around mental health that can really support you. It's important that you know that there are resources available to support your employees. your organizations, through the borough, and that it's really around how we make every contact count is really that approach to behavior change. So it's really using the day-to-day interactions that organizations and individuals have with others that enable them to support and make positive changes, both in their physical and mental well-being. So there are different plethoras and avenues around consistent and concise healthy lifestyle information. There's a lot to engaging in positive conversations. So there's a lot there in terms of information that you can actually get from MECC training that is offered. So please do reach out in terms of that. Pause for slide for Wandsworth. So that brings us to the end of answering some of the questions. So firstly, thank you so much for engaging and being part of these conversations. To learn more in terms of Wandsworth Borough Council, there's some really good resources available. So many of these links, etc., will be available after the session. We've got the Wandsworth Healthy Workplaces Assessment, which you can also go through and have a look at. We've got public health at wandsworth.gov.uk. If you are within the Wandsworth borough and would like to get in touch to get, give some feedback, ask any questions, how do you get more actively involved? What is it that you are looking for in terms of resources? And then there's also the Wandsworth MECC training. This is making every contact count. There's a plethora of resources available to support you as employers and as organizations in the borough. So really working towards that healthy workplaces is what is important. The MECC is an approach to behavior change. So it uses thousands of day-to-day interactions that organizations and individuals can use in order to make those positive changes towards their mental and physical well-being. It's got a plethora of resources in terms of information to engage and enable individuals to create those conversations around their health. And really, it's how do you develop that competency in terms of the support offered by Wandsworth. So please do reach out. I'm sure it can really enable you to support your workforce and the greater community in terms of healthy workplaces. A big thank you for listening in. All this will be available on the website, so you should be able to see it coming up soon. Once again, a big thank you to Nadal for the support, and thank you for being here today to be part of the conversation. So we really appreciate it, and thank you again.